and then some alcohol is produced along with it. But the alcohol percent is almost like a wine. You don't want it to go beyond 8 or 9%.
When we are talking about medicines, the next thought that comes to my mind is about the lead content, which many people talk about.
There is some fact to it. It's not completely out of nowhere.
Okay.
There can be issues.
Many people think that, Ayurvedic medicines are slow or they take a long time to heal, yes. And also they may have side effects.
It could be slow. It could be slow. But
Namaskar everyone. Today we have a special guest. He's an Ayurvedic doctor with many years of experience. And we're going to be discussing very interesting things about Ayurveda, some very basic fundamentals that many people don't know about. So, welcome Dr. Neelesh to the podcast.
Namaste.
So, let's talk about Ayurveda from a layman's perspective, okay? Many people think Ayurveda is massages.
Well, massage is a good start, so it's not wrong. It's certainly not wrong, but it's
a very small part of it, isn't it?
Calling it even the tip of the iceberg is still too less, because massage is one of the therapies that Ayurveda offers.
So when we say massage, we mean the panchakarma part of it?
We could call it as a part of panchakarma, but it is not panchakarma, because panchakarma is a more complex set of therapies made of two words, this pancha and karma, where pancha is coming from the five. We have pancha mahabhuta, panchakarma, so pancha indriya. So the word pancha relates to five different things, and this is a set of five basic therapies. And classically, panchakarma means five different methods of cleansing your body. So you can cleanse the body with the help of getting the so-called toxins. I mean, I don't agree to the word toxins to this. But you have the cleansing of kapha, which is done with the help of medicines which help you vomit. Then you have other medicines which get you to purgate, which means you get loose motions with the consumption of these medicines. So that's the second route of expulsion. Then you can also give medicines directly into the colon, what we call as enemas. That also cleanses the colon, but it's not just the cleansing of colon, it's doing a lot more other things. Then you have medicines which you put through the nose, where the nose can secrete a lot of things which are not required by the body. And the last one, it is called as bloodletting. So you donate your blood, as an example. So that can be seen as a way of five methods in which you're cleansing your body, and these five cleanses is what we term understand under the word panchakarma. But for all of these therapies, the body needs to be prepared. You can't just wake up in the morning, say, okay, today I'm going to do a XYZ panchakarma. You have to prepare your body. There are indications, there are contraindications. So if there are indications, then still with the indications, you have to get your body prepared so that the body can withstand, and not just withstand, it can actually give you the best out of the cleanse that you're trying to approach. And for that thing, massage or oiling is an important therapy. So that is a preparatory therapy for many other therapies that would be following.
Wow,
but that therapy itself is so fantastic. Most of the patients, they start with it, and we don't go to the actual cleanse because they are so good with, my knee pain has gone, or my body ache has gone, or my skin has improved, or my sleep has improved. So whatever reason we wanted to get the panchakarma, we prepare the patient, and by the time we're doing the oiling therapy, the patients are very happy and they say, okay, thank you, doctor, thank you so much, because it's a fantastic therapy in itself.
So coming to, again, people look at Ayurveda as one was massage, the other one understanding is vat, pitta, kaph, kaph zhalai, or maza pitta vadl hai, and all of that.
This is a very, very important thing, because people have their own conceptions about what vat is, what pitta is, and what kapha is. For me, it means, okay, the patient or the person is not doing well. He has some signs or some symptoms which he's aware of, and he wants to share them with me. So people have their own ideas about what they mean when they say, I've got vata, or I've got pitta, or I've got kapha. But I think with experience, you start to understand, well, that is what the patient or the person is saying, and I need to look deeper. I need to see what exactly is happening inside the body. Right. And the classical interpretation of vata, pitta, kapha may maybe exactly what the patient or the person is saying, or might be completely different. For
Okay.
example, headaches, when we talk about ache, when we talk about pain, then Vata is seen as the core dosha, which is not in order. So they say that Vata drute nasti shulaha, which means without Vata's involvement, you will not get pain.
Okay.
And the pain kind, which we understand as pain, where you talk about headaches or joint pain or body ache, etc. So that way, it's something related to Vata, but the layman has his own way of understanding what he's going through. And physicians, any Ayurvedic physician knows this, and he will decipher it in a manner that is clear to him, and then
Correct.
I didn't understand it, whether it's really a Vata issue, a Pitta issue, a Kapha issue, whether two doshas are involved, or all the three are involved in whatever sign and symptom that the patient or the person has, and then help him accordingly, and not go ahead with just calling it Vata, Pitta, or Kapha.
Yeah. Also, I've come across books where again all these attributes are associated with these three doshas, okay? So, Vata means somebody who is very lean and tall and can't sit stable in one place. Pitta would be fury, hot headedness, or whatever. So, what are these attributes all about? I mean, how much to go by them? And these are mentioned in proper books,
Yes.
So
Yes.
can you throw some light on that?
I think what you're talking about is the concept of Prakriti, which comes across in Ayurveda. So
Okay.
we try to find out when the patient is sitting in front of us. Sometimes it is possible, sometimes very difficult, because the disturbance is so much that the so-called Prakriti, which means the constitution, which means how the person actually is.
Yeah.
We try to find that out, and we try to find out, okay, which of the doshas have gone out of balance, and therefore which of the sign and symptoms have come across. So that is, I think, what you're talking about is the Prakriti part. But unfortunately, there are some dogmas related to that, which I think are a problem. So, for
Okay.
example, a Vata Prakriti person is lean. Well, the point over there is to understand that the tendency is to be lean, or the tendency is to be overweight, or the tendency is to gain weight, or the tendency is to lose weight very quickly. And that is what the core is about. And these things are attributed to the what you called as those characteristic properties of Vata, Pitta, or Kapha. And we try to understand them, which of these are dominant in the person. So as an example, we'll stick to the one that you mentioned, the person is lean.
Okay.
Now, being lean, one of the characteristic properties of Vata is called as Laghu, which means being light. So the person is going to be lighter. There are other attributes also. So whether you're lean and dry, so dryness becomes another aspect which comes again from Vata. So somebody might be lean but doesn't have to have a dry skin. Chances are very good that he might have a dry skin issue as well, or just the tendency of having a dry skin, and he won't realize it till somebody points it out. Your skin is very dry. And for him it is so since birth, so he doesn't see it as something different. And
Right.
that's where Ayurveda tries to see what is the constitution of the person, and then there are certain traits that you see in those specific constitutions. So there are millions and billions of combinations, and therefore there's a in Marathi there's a nice saying we call as Vyakti Titkya Prakriti, which means the number of all individuals are ultimately individuals, because they are just unique. So everybody is unique, and the Ayurvedic perspective is to find it out, what is this person's core character, because that helps us to help him understand what is going to be suitable for him, what is going to be not suitable for him, etc.
So, does it all depend on the lifestyle of the person, the issues that they are experiencing, or the aches and pains? Overall, everything is factored in, even the mental health is also factored in all this?
I'll give a simple example to keep things in perspective.
Yeah.
Somebody is happy to have 7 hours of sleep, and somebody is unhappy to have 7 hours of sleep. So, from the perspective of Ayurveda, if we understand the constitution of the person, which dosha is dominant in him, that helps us to tell him, well, 7 hours is good for you, or 7 hours is not good for you. You should go for 8 hours, you should go for 8.5 hours, you should go for 9 hours, or you should go for 5.5 hours as well.
Many people go to check what their prakriti is by giving these online tests, whether they have vata prakriti, pitta prakriti, and all of that. How much, I mean, those are again very subjective, isn't it? Because there are only three options to choose from. I've also undergone one to check, out of curiosity. And there are only three options, and I'm okay, my answer is not fitting in these three. So what do I do? But there's no other option. So isn't that very subjective and very limited way of looking at it?
I think you've nailed it. Whatever you say is absolutely right. But it's a start, I would say. It's better than nothing at all.
Okay.
And you could start there. It's somewhere
Okay.
somebody needs to start, and I think that's a good point to start with.
All right.
And the best thing is, after those online tests, there are going to be certain suggestions that they're giving. I'm quite sure most of the online tests are not going to suggest you, okay, now go for this panchakarma. They're going to say, well, do a massage, or you need this much of sleep, or it's good to have these kind of foods, etc.
Right.
So the buffer that is available for you of error that you can do is quite big, but still it's not that bad, because the suggestions which are going to come at the end of these tests are actually very simple and not too complicated, and at the end of the day, simplifying the stuff for an end user.
Right. So I'm going to come to yoga now, okay? Connecting yoga and Ayurveda. Say, for example, somebody who's suffering from acid reflux. Would it make sense for that person to do inversions, or would any movement affect him or aggravate his situation? Would there be such a scenario?
From the
There would
Ayurvedic
be, right?
perspective, yes. From the Ayurvedic perspective, as I mentioned earlier on, everything is pretty individual, and that being individual part also changes with time, seasons,
Correct.
age, the condition that the person is going through, etc. So there are quite a lot of nuances that can come into, but there are very specific things that you should take into account, especially from the Ayurvedic perspective when you're doing yoga. Most of the yoga teachers, I believe, do understand that. So they already have a concept about what is good for someone. Okay, you've got spondylitis, please be careful with your neck exercises,
Right.
cervical spondylitis as
Right.
an example. But not just that, there are also other nuances that could come in. So for example, as a thumb rule, if you have a lot of vata in you, you have a vata condition, you have a vata kind of a prakriti.
Yeah.
Now, in this, mostly a vata prakriti person will tend to be agile, mobile, having difficulties to stand still, is going to be on the move all the time. Movement is a part of him, he cannot stop that thing. Now, if this person is asked to do a Surya Namaskar, in that case, I would, as an Ayurvedic physician, say, well, you could do the Surya Namaskar, but keep the movement as slow as possible. Keep a good watch on how deep you're breathing, because the chances are very high that he's going to do a shallow breathing, because his respiration rate is rather faster as compared to a Kapha Prakriti person or a Pitta Prakriti person.
Wow. Okay.
So something simple as that can make a big difference in the effects of yoga practice that the person is doing for himself, with a small change in it.
Small changes, yeah.
Or another example for a Vata Prakriti person would be he doing exercises which are involving a hell lot of balancing. So for example, he's standing on the tip of his toes on just one leg, and the other leg is pulled backwards. One of those beautiful asanas which we see done by Iyengar on, you can see on this, when he's holding the leg from the back side of the of himself. So it's a huge balancing process that is going on. Now, a Vata Prakriti person probably doesn't need that. Most probably he's already doing it too much. He's overdoing it. And now he's doing the same thing in his yoga asana. It's going to be a total different thing. It's not going to bring him as much as what it would bring, let us say, for a Kapha Prakriti person.
Okay.
So things like that can help you. Understanding Ayurveda can help you to get your yoga practice to a totally different level. Would be my opinion.
Could you throw some light on the Kapha and the Pitta Prakriti also that way? So then we get some clarity on the attributes.
Well, Kapha, I hope you don't catch me with you said it that way.
Not at all.
But let us consider a usual Kapha person where he's going to be rather bulkish, going to be less. He's going to talk less. You ask him a long question, the answer would be a single word, yes or a no. That is typical for Kapha, where they are more laid back, more relaxed. Now, asking this person to go into meditation to relax himself is not really the best would not be the best thing in my opinion.
Okay.
He'd rather do some good yoga movements, like for example, getting back to the Surya Namaskar, where the Surya Namaskar is done with a higher intensity, with probably a little bit of more speed as compared to a Vata Prakriti. So we are saying the Vata person, get your speed from 600 kilometers per hour to get it down to 20, whereas the Kapha Prakriti, we say, well, good, you get from the 20 to at least 35 or 40. So that's what would be with Kapha. And in my small experience, I would say with Pitta, there is a lot of almost difficulty to see the difference between obsession and compulsion, obsession, and something he's doing for himself. So that's where you need to fine tune the practice of a Pitta Prakriti person, where he's doing his yoga as almost obsessively doing it and not just doing it for getting the health benefits, where the obsession takes over and the benefits go behind, and then poor person is suffering from. So after the end of the yoga therapies or the yoga sessions, he's completely exhausted and not feeling the power and energy which he started with. Because the initial phase where he gets into yoga, but then it gets into almost an obsessive condition, and then he's doing too much of yoga, giving him problems related to yoga.
Got it. So it's so important then for all yoga teachers to understand Ayurveda in a little more depth than just skimming through the dosha types or whatever, so that would probably help their practice also, their teaching also.
Yes, I believe so. But it's very difficult when you're standing in front of a class with 10, 15, 20 students.
Correct.
To filter it out.
Absolutely. I agree.
But it's doable, I think so. And I think most of the people do take take this effort to get to the point where they are somehow fitting in the best for the whole group. And when they're moving around among the students, then they're telling somebody, take it easy. Or somebody's taking probably too easy, then why don't you stretch your arms a little bit or move yourself a little bit? And that is what they're actually doing then, in my opinion. They've got this understanding of Ayurveda into the actual practice of yoga.
Correct. I know some teachers, in fact, who follow Ayurveda very closely. And they're so observant is when a student walks into the class, that is the time they sort of start observing the student. That's where the beginning, it starts rather. And then they're looking at every individual sort of, and making them practice accordingly. It helps. And also I have seen some teachers to go to such an extent where any new joinee has to fill a questionnaire. Okay. And there are certain questions asked which sort of helps them understand what this individual is.
What I just wanted to add to this conversation is you have these Vata, Pitta, Kapha, but that's just one aspect of it. There is also the tissue aspects of it, which is very important from the Ayurvedic perspective. So you have the blood tissue, you have the lymph tissue, you have the flesh tissue, which can be understood as what is happening with the muscles of the body. Then you have the nervous system, the nervous tissue, So these tissues can also be incorporated into your practice of yoga.
Okay.
Where a lot of teachers are taking training related to these nuances of Ayurveda, which you can put into the practice as well.
Okay.
And not just the tissues, then you have also different systems. You have the respiratory system, you have the digestive system, you have a number of other systems also which are considered in Ayurveda, which can be included in the practice of yoga. Especially if you want to be very specific to an individual and want to do something, you have a specific goal in mind for that individual.
Right. Can you expound a little more on tissue? I mean, what is tissue?
So, well, I think we talked about the doshas. We have this Vata, Pitta, Kapha. They can be considered as things which are governing the body in the physiology of the body. So, how the body is functioning by itself. But the body is made up of something. So whatever we can hold, whatever we can actually take in a teaspoon or, actually has a physical form, these things can be understood as tissues from the Ayurvedic perspective.
Okay.
From the purely academic perspective, you have 7 basic tissues that are there in the body. These tissues have sub-tissues. These sub-tissues and the tissues together at the physiological level give out some excretory substances. So for example, hair, you have sebaceous glands secreting stuff, you have dead skin coming out of the body. So there are tissues, there are sub-tissues, and there are also excretory substances. For example, substances coming out of the ear, what we call as ear wax. So these are seen as excretory substances which form the body, which give the body a mass, so on and so forth. So you have a set of tissues which are forming different systems inside the body. These systems are functional units inside the body which are helping me to be what I am.
Okay.
And so these aspects are also taken into consideration in Ayurveda.
What about blood tissue? I mean, something inside the body.
Absolutely.
So, I mean, how do we understand that? Or what do you mean by blood tissue? Because for me, tissue is something that you can feel, right? So, what about blood?
So there are tissue. The word tissue comes actually from modern perspective.
Yeah. In Ayurveda, it is called as something else, no?
In Ayurveda, it is called the umbrella term is called as dhatu.
Dhatu, correct.
Dhatu, that's the umbrella term for it. So you have liquid dhatus, you have solid dhatus, you have semi-solid dhatus, you have hard dhatus. So bone is something which is called as asthi, or actually asthi is translated as bone. Yeah, absolutely right. So asthi is translated as bone, as a tissue, but it is something to help us understand what asthi could mean. But by the core meaning of the word asthi, it means a tissue which is hard, which has a certain toughness to it, like bone tissue has.
Correct.
So something which is hard, which is tough, which helps the body to have a structure of its own self, is what any Ayurvedic physician would understand when he hears the term asthi. As a tissue. So blood is also one of those tissues which, from the Ayurvedic perspective, it is that tissue which is transporting, from the Ayurvedic language, transporting prana inside the body.
Correct.
Now we try to interpret it in modern language. We see, okay, prana could be something like oxygen, which is transported all through the body, also in a liquid format, which is blood. So the oxygen is getting attached to this liquid tissue inside the body. It's a connective tissue at the end of the day, and therefore it is helping the body to get its prana so keeping it alive. That is how you can interpret the word prana.
Right.
So that way, understanding these tissues and then also putting them into practice. So, understanding the tissues and not just vata, pitta, kapha, but understanding the tissues, then understanding the different systems. So there are also systems that have been described in Ayurveda.
Okay.
So again, systems is a different understanding of the word system from the modern perspective. What the Ayurvedic word would be srotas.
All right.
So you have the respiratory system as translated into modern medicine.
Yeah.
But from the Ayurvedic perspective, it is called as the pranava srotas, which is very important, and which any Ayurvedic physician would take it into consideration, all these different srotas or all these different systems, and then make suggestions. You have these Charak Samhita, Sushrut Samhita, Bhagavats, Ashtang Hriday. We have the Bruhatrai, Lagutrai, all fancy words, but they have their own meaning in the sense. So when we talk about srotas, one of the philosophers which I am totally into is the Charak Samhita. So he says you can't count the number of srotas, you can't count the number of systems. So every time there's something wrong inside the body, look into which system might be dysfunctional. He has classified them into certain different types. Sushrut comes, he's a surgeon, he's one of those surgeons from the classics. He describes 22 different, so 11 pairs he is mentioning in
yeah, that's what even I had heard of.
Absolutely right. So you can enlist them, you can enlist a few of them. Sushrut says there are 22 pairs, Charak says there are innumerable ones. Okay. So sometimes, even in Sushrut Samhita, when he discusses those different types of srotas, at the level of diseases, he sometimes mentions the srotas which he hasn't mentioned in the basic ones. So it's actually very difficult to put a number to it. When we talk about vata, pitta, kapha, these are energies. You just have to imagine what is happening inside the body, and then you have to see, okay, this is vata, it's very theoretical. These are principles that we are talking about. When we are talking about tissues, it's something which you can actually hold in the hand. Yeah. So in Sushrut Samhita, he's described how to, what is the, Caesarean is the German word, I can't remember the English word, dissection. So nowadays we do dissection, but Sushrut has described to actually, if you want to become a physician, he says you have to work on a dead body. You have to see every tissue inside the body. He's described 7 different layers of the skin.
That was interesting.
Forgive me for being
So-
probably too.
Not at all. Not at all. It puts things in perspective, right? It gives you a better understanding of what it is. I'm enjoying it. Yeah. So now from here, you know what I would like to understand from you, from Ayurveda rather. This is such an ancient science, right? At that point of time, the medicines that they must have created would be what? In tablet form, or so many herbs and medicines around, right? Uh, Today, do we use the same form, or have they evolved, or what kind of medicines does Ayurveda has? We have, I think some are in liquid form, some are in powder form. So, do you want to?
Medicines are, I would say, the primary source of medicines are
Okay.
herbs. That would be the primary source. Minerals are also used in Ayurveda
Okay.
as a form of medicine. When we talk about minerals, then we have a separate science or a separate branch in Ayurveda which deals with medicine and medicinal preparations,
Okay.
which is called as Rasa Shastra.
Ah.
Which then takes into consideration not just minerals, it also takes into consideration metals and heavy metals. So for a layman, I would think something like anemia, you have less iron in your body. Ayurveda has some Rasa Shastra preparations which are called as bhasmas. So you have iron treated in such a manner that the bioavailability of that iron is very high, can be
Okay.
picked up very easily with less stress for the body to deal with, picking up iron. It's a very complex process that is happening inside the body, but for that the Rasa Shastra preparations are also very complex, where they are
Right.
treating these metals in complex methods which make them bioavailable. I could just pop in a piece of iron. It doesn't mean that my
Doesn't
body is
mean,
actually
correct.
get it. It's just
Correct.
going to be passed out of the system.
Right.
But so that the body can actually pick it up, there are complex alchemistic preparatory methods which help the body, which help the substance to be converted into forms which the body can pick up
Can
easily.
pick up.
But primarily, like I mentioned, you have a lot of herbs that are used.
Okay.
And those herbs are then used in different forms. You can have a tablet, you have combinations of herbs, then you can cook them. You can cook them in certain manners, you can cook them, you can make wines out of them. So you have asava, arishtas. So
Okay.
there's a big range of medicines and possibilities of medicines. Then also the route of administration of medicine is also something which is fantastic. You have medicines that you can put through the nose inside your system. You can use the skin as a route of administration of medications. Earlier, when we talked about the panchakarma, you can have the route of administering medicine also going in the form of an enema. So there are different methods in which these preparations are made in accordance to what is the best for that individual.
Correct.
And that's the job of the Ayurvedic physician, to find out what suits best to my
Right.
patient.
So bhasmas would be minerals, which
Yes, in the
are,
first, yes.
what was that? What was the other term you used?
Rasa Shastra,
No, not Rasa Shastra. The wines,
Asava and Arishta.
asavas and arishtas. Those are okay. All right. They're in the form of not literally wine, but I think probably aged and
I
some
would
such
like
process.
to think, yes, wine I think is associated very closely with the use of grapes. But this
Yeah.
is something which you make decoctions, or you make juices out of different
Juices
herbs,
out of medicines,
and they are
yeah.
processed in a manner what we call as fermentation, and then some alcohol is produced along with it. But the alcohol percent is almost like a wine. You don't want it to go beyond 8 or 9%.
So the arishtas,
Correct.
the names, some of the names that I know, the Shamula Arishta or Shvagandha Arishta. So these are all sort of wines,
Yes.
aged and
Fermented.
Yeah, that's the right term.
That's the right term that you could use.
Okay. Bhasmas, arishtas, what else? I mean, what are the other terms that are used in?
Oils we can use a lot. Ghrithams we have a lot of.
Ghrithams.
You have
Okay.
another set of medicines which we call as the Google preparations. So
Okay.
certain gum is used which is called as Google.
Okay.
So that's another set of medicines that is used. You have churnas, you have swarasa, you have vatis and gutis. So
Okay, they are again two separate things. Vatis
small and
gutis
large.
are.
Yeah, small and large.
Okay,
Just a
okay.
simple nomenclature.
And gugulu is the gum part.
Google
which
is
is
a herb.
used.
Yeah, the gum which is used to to make medicines,
Bind
where the gum itself is highly medicinal.
Okay. Okay. Because some names that I've come across is Trikatu, Gugulu, and then there's Trikatu also, I think.
Triphala, you mean? You mean
Is it
Triphala and
Triphala?
Triphala Gugulu? Yes.
Oh, okay.
Yes. Trikatu is a set of 3 herbs put together: pepper, ginger, and long pepper. So
Okay.
that is Trikatu. But the Gugul one, probably, which you heard, you get just plain Triphala and you get Triphala Gugulu. So the
Okay.
preparation Triphala Gugulu has some other, it has Trikatu in it, it has Triphala in it,
Right.
and it has the Gugul, which is a gum.
Okay.
Which itself is medicinal. So you
Right.
can also use just plain Gugulu as a medicine.
Okay. All right. And then you can have plain Triphala also as a
Yes,
medicine.
you can have plain Triphala.
Wow.
Because you want to choose, what is the best for the condition.
For that
Do I need
particular.
the Gugulu? Do I not need the Gugulu?
Right. Wow, this is so interesting and so deep. Okay. Now, when we are talking about medicines, the next thought that comes to my mind is about the lead content, which many people talk about. Yeah, there's lead poisoning in Ayurvedic medicines, or there is, a lot of toxins in the medicines and all of that. Do you want to clear the bubble or burst?
No, there is some fact to it. It's not completely out of nowhere.
Okay.
There can be issues. So if you talk to a Rasa Shastra expert, he will be able to put light onto this subject, because the way a medicine is prepared, that is very important.
Okay.
So even when you make a medicine, in pharmacology in Ayurveda, they have tests, classical tests to see how whether the medicine is done in a manner that it can be used inside in a human. I'll give you another example. There are a lot of poisonous herbs in Ayurveda which are actually used as medicine.
All right. Okay.
Because there's a beautiful saying in Ayurveda, Sarvam Dravyam Aushadam, which means everything that you can perceive is a medicine. So, for example, the conversation that you are having can work as a medicine. So, everything that you can perceive can be utilized as a medicine. But the thing is, the Vaidya or the doctor or the physician is the fellow who can make something into a medicine so that it has its medicinal values. Now, a Rasa Shastra expert can make something which is poisonous into something that is a medicine.
Right.
These are complex chemical processes. These are complex processes. You take temperatures which are a few thousand degrees high.
Okay.
That is how you make a bhasma. You put certain herbs together, you heat it to a few thousand degrees high, and that is when you get a proper bhasma. But if somebody takes shortcuts and doesn't make the medicine properly, or there's something untoward happening while making the medicine, and once you have the medicine finished, the classics have described a few tests to see whether the medicine is actually a medicine or whether it's not a medicine.
Okay.
So these things can creep into, but I think good companies, good people, there are you can see a lot of research papers. You just have to go on to Google Scholar and do a few researches, and you'll see that there's a lot of medicines which are considered to be toxic, or which are horrible, or which are like lead, like a poison, like lead poison, like you mentioned. They don't show these things. So there are studies which are saying that I've used a Naga Bhasma or a Vanga Bhasma in a proper scientific manner where there is no toxicity seen.
Okay. Or maybe the toxicity has gone down because of the process.
Correct. Made in a certain manner takes away the toxicity of the substance.
Right.
So you have not just lead, you have also mercury. Mercury is very widely used in Ayurveda.
Oh, okay.
In Rasa Shastra, I mean, sorry, it's not the right word. It's not widely used in Ayurveda, but used as a part of Rasa Shastra, as a part of pharmacology.
Okay.
So pharmacology, you have Bhaishaja, which goes mainly into the herbal aspect, and you have Rasa Shastra, which goes into the heavy metals.
Okay.
And these medicines, there are n number of research papers which are showing, okay, theoretically, I've used mercury, this should be toxic, this should kill my kidney in a few days, ultimately killing the person who's consuming this medicine. Nothing happens, because it's not just mercury in the form that we can imagine ourselves. It's a complete different form of mercury. But as a layman, you start to think, my God, this has mercury in
Yeah.
it. My God, this has lead in it. My God, this has XYZ substance in it. Is very certainly toxic. No, it is not like that.
And it must be in a very minuscule amount, enough for its effect to take place,
Absolutely
probably,
right.
isn't it?
Absolutely right. So I'll give you another example from modern medicine to keep things in perspective.
Yeah.
You have snake venom. Take snake venom is poison that we're talking about, but snake venom is one of those things which is life saving. So
All
it's how
right.
you use it that is what
For
decides.
humans.
For humans. For humans.
Okay.
Snake venom, out of snake venom, you can make medicines which can be put into use for humans. So technically, snake venom is poison, shouldn't be used, but you you go with the right doses, you go in the right manner, you go in the right way of administrating that medicine inside the system, and the same poison now becomes a life-saving medicine.
Correct. Because of the process that is undergone.
Correct.
Yeah, that doesn't mean you catch a snake and make him bite you.
Yeah.
But yeah.
Absolutely right.
Okay, I get it. So, wow, this is an eye opener actually. Yeah. Also, many people think that, okay, Ayurvedic medicines are slow or they take a long time to heal, yes. And also, they may have side effects. Probably, again, maybe, just to simplify it, probably if you're taking the wrong medicine which is not suitable for your requirement, for your body's prakriti or the need of the hour, then it would have its side effects, probably.
Absolutely right. Absolutely right. I dislike the word side effects because the way I understand how things work in our systems is that these are simple effects of the medicine. So every medicine has its effects.
Has its effects.
Some effects we don't desire when we call them side effects. It's actually the effect of that. It is going to happen. It is what that medicine is going to do, or that herb is going to do, or that drug is going to do. It's simply a part and parcel of that thing. We just clad it into a fancy word and call it as a side effect, but it's actually the effect of that medicine.
Okay.
A good Ayurvedic physician takes into consideration all these effects that the medicine is having and pick the right medicine for you where all the effects are just desirable or suitable for the condition.
So yeah, so there has to be like a time frame given to a treatment. Can't say like, okay, in one dose if you have felt that, which means, many people do that. I mean, I know who have thought of taking Ayurvedic medicine, and probably their explanation of that is nahi bahut garam ho gaya medicine. It was too heaty for me, so Ayurvedic medicine is not for me. Or they realize, oh, it's very slow to take effect and therefore it is not for me. But I guess they need to give it some time, probably.
Yes, I would say slow is another. Slow is, it could be slow, but in my experience, you have people turn to Ayurveda as the last resort. It's not the first resort.
Is that
Very
so?
often I am one of those unlucky doctors who patients visit when nothing else is helping them.
Okay.
So that could be the other reason. So the person has tried a lot of things and the condition gets so chronic that it becomes very difficult to heal. Just a simple example: you get a common cold. With the common cold, you get a headache. In this kind of a headache, if you apply a paste of dried ginger on your forehead, chances are very good that your headache vanishes in 10 or 15 or 20 minutes. So that is one way of looking at it. And then there's another way of looking at it. Well, somebody's had a diabetic condition and he's suffering from diabetes for the last 10, 15 years, and now the kidney is giving up. Then he turns to an Ayurvedic physician. Of course, it's very difficult to revive a kidney who is saying, I am done, I have finito.
Yeah.
Now I'm trying to help him with Ayurvedic medicine. It's going to take a much longer time because he's already having the situation for 10 years or
for
15
10 years, probably, if you're suffering from this illness, and now if you think Ayurveda is going to treat you in a day or in a week's time, that's a little unfair to judge a field of medicine. Yeah.
Yes.
Okay.
But compared to modern medicine, I would say that Ayurveda might take a longer time as compared to modern medicine, depending on the condition. Basically, modern medicine is very, very acute, very quick to work. Sometimes you might require it. Sometimes it is rather necessary to take it because otherwise, you're facing a huge complication if you're not taking that medicine. And yes, it does function very quickly as compared to Ayurvedic medicines. Certainly, that I cannot disagree at all.
Like if you go to an allopathy doctor, okay, the allopathy doctor will check your, probably understand what is going on with you and treat you with your symptoms, probably, right? Ayurveda goes much deeper. We work at a holistic level also in Ayurveda. Or is it again understanding only the physical aspect, understanding what is going on, and then base the medicines?
If you look at the aim of Ayurveda, we talk about health as swasthya or swasthya hita. This being the aim of Ayurveda, the definition of health is very complex in Ayurveda. So it talks about the balance of the dosha. It talks about the optimum conditions of the dhatus, which is
Right.
the tissues of the body. It talks about the optimum condition of what there's a term called as Agni, which means can be loosely equated with the metabolism. Then you have the equilibrium of this Agni with the tissues and the doshas. So they are all working in sync with each other. Not just this, then Ayurveda talks about the 5 sensory aspects and the 5 motor aspects. These also, when they are functioning, the person is experiencing happiness. There is no stress, there is no discomfort of any sort. Rather, when these things are functioning, there is a feeling of happiness. So, for example, you take a walk, your legs are moving. You feel nice to take that walk. You feel
Correct.
nice. That is what this sensory and the motor aspect. So, for the sensory aspect, there's a lot of light coming onto your face, and then you start to feel very uncomfortable with it. Sometimes even not lot of light, just simple light, and you want to stay in the darkness. Or there's some child crying around you, and then it starts to get very irritating. So this is the sensory aspect which should actually experience sukha, should actually experience happiness, should, when it's going through its normal physiology, there shouldn't be any discomfort. On the contrary, there should be so-called happiness. And then it takes it to the next level where you talk about the happiness of the mind, satisfaction and happiness of the mind. So the mind is also experiencing it. And then the last level where they talk about also the Atma.
Okay.
So these different levels is what is the aim of an Ayurvedic physician to get the patient to. It's the physical, it's also the mental, and also I don't know whether I should call it as a spiritual, but also to that level where the person is experiencing happiness and well-being and satisfaction, etc.
Yeah. That's more of a holistic approach in any case, right? Yeah. So to add to that, nowadays, so it is always advisable to go to a physician and consult a physician and then decide what your course of action should be for whatever you're suffering from, right? Today you get supplements out in the market. Ashwagandha, have ashwagandha if you have XYZ problems, have this if you have, XYZ problems. What are your thoughts on that? Because now those supplements are available across the counter. I mean, you just have to order them online.
Yeah, I think at the time when we started the discussion, it's very clear that it is very individual. Ayurveda is about an individualistic approach.
Correct.
And it would be sensible to speak to your physician or
Physician.
somebody who has an idea about Ayurveda, whether I should take this medicine, how much do I require this medicine, for
Correct.
how long do I require,
Correct.
in which part of the year should I be consuming this medicine, when should I be stopping this medicine, when should I be restarting this medicine.
Great. Yeah.
And not very comparable to popping in a multivitamin pill, which in my personal opinion is also abuse.
Yes.
Ask a doctor.
Ask a
Certainly
doctor
you have
if
your
you really
family
need
physician,
it.
you have people around you.
Yeah.
Ask them. It's just a phone call or a message or something, and I'm quite sure they'll be happy to help you.
They'll be happy to help. Yeah. All righty. On that note, we will, I guess, end the conversation here and probably continue in our next series. Yeah. Thank you so much for coming over and spending your time and giving us so many important inputs, which probably a layman doesn't really know of. I hope it's going to help you guys. Thank you so much for watching.